Mrs McGrath was admitted to HSS Rehabilitation in the Home program following a left total knee replacement for reconditioning and early discharge from hospital.
One of the best things about the Rehabilitation in the Home program is that it's multidisciplinary, so you have access to a wide array of health professionals in your home, helping you with your rehabilitation and wound care needs, and there's also equipment if you need it.
Over 6 years ago I broke my knee, and having recovered from that, unfortunately arthritis set in, so I needed a replacement knee to be able to walk properly, and had the operation 14 weeks ago.
I think it's really important to have liaison nurses coming to the hospital for the patient's well-being and for their continuity of care. They are so reassured once they meet a person face to face who knows them and knows what's going on with them and what their needs are when they go home.
After a routine visit by one of our physiotherapists, it was handed over to the office case coordinator that Ms McGrath may actually have a post-op knee infection to her surgical incision site. We consulted with her surgeon in order to identify the best course of action, and we provided Ms McGrath with further registered nurse ongoing visits. She was commenced on oral antibiotics by her general practitioner, and we continued to see her in the home in order to heal the wound.
I was so impressed that the physio was the one who spotted I might have an infection in the wound first, and within an hour I had a phone call coming. Someone was teeing up the nurse to come and visit me to check it out, and very promptly we had care happening for the infection that was in the knee. The best part of the services were the staff. They knew what they were doing, they were professional. They all rang the night before and confirmed the time they were coming, and that was very helpful, and I planned around that. As well as cutting down the risk of other people's infections, it's more comfortable in the home environment, and once you've got past needing the first acute care, it's so much nicer to be home.
On discharge from HSS post-occupational therapy assessment and physiotherapist input, Mrs McGrath is mobilising safely at home and continuing with an ongoing home exercise program. The wound infection has resolved through consultation with her specialist and regular registered nurse care.
HSS began the first hospital in the home in Australia in 1989. I feel quite passionate about the difference we make in patients' lives. We can look after them throughout Australia. We can provide them with any care that they're actually requiring. We make such a difference. We keep them out of hospital. They don't have to stay in hospital for extended time. They don't have to be in hospital for a rehabilitation program. They can be rehabilitated in their own home. It's a wonderful service now that we provide, and every day I celebrate what we can offer people around Australia.